Wouldn't it be great if seeing a doctor was as quick and as easy as calling an Uber? In some places, it is. New companies are now allowing patients to use an app to order a doctor to their home as simply as they order a ride. Thanks to innovations in technology and the sharing economy, the old-fashioned house call, which had become a luxury that only the richest could afford, could be making a comeback for average patients. This means personalized services that work around your schedule. No waiting weeks for an appointment, or missing classes or work because you had to take public transit to a doctor's office or wait for hours in the ER. And importantly, it could also mean getting better care. Doctors report that these services give them more time to focus on the patient and to practice real medicine again. New health services like these are emerging because entrepreneurs and business people had the freedom to experiment with new ways to serve customers. As these startups have gotten off the ground, they weren't stopped at every stage by government regulations and bureaucracy. They had freedom to innovate, which is key not only to our economic growth, but to our well-being. I call it permissionless innovation because this innovation doesn't have to seek approval or get a license at every step in order to move forward. Instead, innovation can be rapid and responsive to current needs. The Wright brothers never asked anyone if they could build a plane, and Steve Jobs didn't ask permission to build the iPhone. But this engine of growth and progress is often threatened. On-demand doctors making house calls have been allowed so far, but their competitors, offering more affordable services via webcam, known as telemedicine, have not been so lucky, with some states imposing strict regulations on such services. While done in the name of public safety, such restrictions actually mean fewer services, higher prices, and reduced access to care. If we want to improve the affordability and accessibility of healthcare for all, we need to let the healthcare sector follow the example of Silicon Valley and allow innovation, new ideas, and competition to flourish. On-demand house calls could be just the beginning.